Hi everybody, so today we're going to be talking about how blood flows through the heart. So I got a picture of a heart, or drawing of a heart here. This is going to be my right side of the heart, and then this is going to be the left side of the heart. So let's go ahead and take a look at this, okay? So the first thing that's going to happen is I am going to have deoxygenated blood enter into the heart. So I got this deoxygenated blood, and it's going to enter into the heart, okay? So if I come over here, I'm going to draw a little flow chart. And now we have deoxygenated blood. Okay, and that's going to enter into the heart. And it's going to enter into the right atrium. So this right here is going to be my right atrium. And then what's going to happen is when the heart beats, you have something right here called a valve. And that valve is going to open up and blood's going to go down into this area here. Now this valve is going to have several different names, and I'm going to go ahead and list them. Okay. The first thing we're going to call this is the tricuspid valve. And the reason they call it the tricuspid valve is it has 3 cusps on it. All right, so it's going to look something like this. It's made up of 3 parts, and then you're looking at this as if someone's laying down facing towards you. This would actually be like this, and then these 3 valves open up and the blood goes through, and then it comes down to here. So it's also known as the right atrioventricular valve. All right, it's also known as the right atrioventricular valve or the right AV valve. Okay, so those are the names of it. Okay, and now what's going to happen is after blood goes through there, it's going to go into the right ventricle. So this is going to be my right ventricle right here. All right, that's going to be my right ventricle. And then from there, it's going to go past the pulmonary valve. Okay, it's going to go past the pulmonary valve. Okay, so I'm going to draw my pulmonary valve right here. All right, and this is my pulmonary valve. And then from there, it's going to go out to the lungs. Okay, now this is actually not going through this area. It's actually going to be a little bit in front of us, but it's going to go out to the lungs. All right, and then we're going to have these 2 areas here. And this area in here is going to be my pulmonary artery. Okay, this is going to be my pulmonary artery right there. All right. So that's the pulmonary artery. Here's my pulmonary valve. Blood's going to go out this area, and it's going to go to the lungs. So it's going to go from the pulmonary valve into the pulmonary artery. Now remember, arteries carry blood away from the heart. And then it's going to come over here, and we are going to move over to here. Okay, and then from the pulmonary artery, it's going to split into the left and right pulmonary arteries, and it's going to go to the lungs. Okay, so now in the lungs, it's going to get oxygen. So my blood is going to become oxygenated, and now I have oxygenated blood coming back to the heart. Okay, they're going to come back to the heart through the pulmonary vein. So remember, arteries carry blood away from the heart, veins carry blood back to the heart. And normally veins don't have oxygen, and normally arteries do have oxygenated blood. So now here comes my pulmonary vein, here comes my blood, and it's going to come into the left atrium. All right, so it's going to go from the pulmonary vein into the left atrium. And then when this beats, remember the top part of this is going to beat at the same time, right? So when this beats, what's going to happen is it's going to go past the left atrium and past this valve right here. This valve actually has 4 different names. This valve is known as the mitral valve. It's known as the bicuspid valve because instead of having 3 cusps, it only has 2. So it's known as the bicuspid valve. It's also known as the left atrioventricular valve. Remember on the other side we had the right atrioventricular valve. Okay, and then it's also known as the left AV valve. So a whole bunch of names for this. Okay, so there, that's the name of this valve. That's all in here. Now, from there, when this beats, the blood's going to come down into here, and this is going to be my left ventricle. Now, my left ventricle actually is going to have more muscle in here than my right, but we'll go into that on another video. So this is my left ventricle. Now what's going to happen is we're going to have our aortic valve. So here's our aortic valve. Okay, so now this is going to go into or through the aortic valve. Then after that, it's going to go into the aorta. Okay, so it's going to go into the aorta, and then the aorta is going to arch around these pulmonary arteries, and then it's going to go out to the body. Okay, so it's going to go into the aorta, and then it's going to go out to the body. All right, and then what's going to happen is it's going to lose its oxygen, come all the way back. Okay, so this is going to be my aorta right here. This is actually, this part right here of the aorta is called the aortic arch. Right? And then you're going to have arteries that go up into the head and stuff. I'll go through that in a different video. Okay, so again, so this is going to be my aorta right here. That's the beginning of it. Right after this aortic valve right here. So this is my aortic valve right here. This is my aorta that's right there. Okay, so that's basically it for how blood flows through the heart. So thank you so much for watching. If you enjoyed the video, please hit the like and subscribe button. I'll leave this up here for a minute. Oh, really quick. So the reason I wrote over here in blue was because this was deoxygenated blood. The reason this is in red is because that's oxygenated blood. So again, thank you so much for watching.